go to the office to get my email.
We ready? I'd like to call this December 18th meeting of the Cookeville City Council to order. Can we have a roll call, please?
Councilman Anderson.
Present.
Councilman Shelton.
Here.
Mayor Salee.
Present.
Vice Mayor Davis.
Present.
Councilman Williams.
Present.
All present.
If we could all rise for a moment of silence, followed by the Pledge of Allegiance. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Do we have any additions or corrections to the agenda?
No changes.
No changes. Seeing no changes, do we have a motion and a second to approve?
So moved. Second.
Have our motion and our second. Any discussion by the council? Seeing no discussion, I'll vote.
5 yes votes, motion carries.
Brings us to the old business portion of our meeting. Item 2, consider approval of minutes of council meeting held on December the 4th, 2008. Do we have a motion and a second to approve?
Move for approval.
Second.
Have our motion and our second. Any discussion on those minutes? Seeing no discussion and having had a chance to look over those, all vote.
5 yes votes, motion carries.
Brings us to our consent agenda. We have 2 items. Item 3, consider awarding bid for rock, Public Works Department, sponsor Greg Brown. And item 4, consider approval of repair to ditch trencher, Water Quality Control Department, sponsor Ronnie Kelly. Do we have a motion to approve consent agenda?
Move approval. Second.
We have our motion and our second. Any discussion on the consent agenda? We need to take those items separately, or?
No, you can just vote to approve the consent agenda.
Okay. We have our motion and our second. Any discussion by the council? Seeing none, all vote.
4 yes, 1 no, motion carries.
Brings us to the new business portion of the meeting. Item 5, consider approval of the 2009 health insurance plan.
Mayor and council members, just like to give you a brief overview of our health plan real quick. I have some information in your packets that I distributed earlier, and it's got this information. It's kind of hard to see on the screen. The city's been basically self-funded for our health plan, or at least partially self-funded for the last 11 years. We participate in the Blue Cross Blue Shield network for the last 6 years, and Blue Cross Blue Shield administers that plan for us. To reduce the city's risk for catastrophic claims, we purchase stop-loss insurance, and right now that deductible that we purchase is $150,000 per covered member that's in our plan. For last fiscal year, 7107 to June 30th, 08, just to give you some summaries of the plan, we have 462 employees and retirees that are covered through the city's health plan. We have a total of 1,100 lives that are covered under our health plan. In terms of trying to keep individuals and members in the plan utilizing the Blue Cross Blue Shield network, we have 96% of the billed charges are being utilized as in-network providers, so we are successful in that our employees and the covered members are utilizing the network providers, the in-network providers, where we get the largest discounts. Total covered benefits that were paid last year through the plan were $3,073,000, with the plan itself paying $2,165,000 of that, and our employees are actually paying $907,000 out of their pocket for benefits, which would be deductibles, co-insurance, co-payments, and things. The average claim cost for that period of time was $4,688 per employee. And we did have 12 members that had claims in excess of $25,000. That's $554,000 of that $2,165,000 that was paid. $554,000 was based on 12 members. And the average age of our covered employee is 49 years old, and the average age of everyone that's in the plan is 37.3 years. One thing when we got to looking at the renewal numbers this year was some of the increases that the stop-loss carrier wanted. Before I get into that, let me just back up to Blue Cross Blue Shield. They administer our plan. We participate in that network. The fee for that, they charge us currently $44.61 per contract per month. Blue Cross Blue Shield is going up $1 on that contract to $45.61. That represents a 2.24% increase in that fee to Blue Cross Blue Shield. The stop-loss insurance, which we try to reduce our risk to those catastrophic claims. This past year we were with Sun Life Insurance. The premium for that $150,000 deductible works out to $187,000 a year. They originally started out with about a 28% increase to keep exactly what we had in terms of the $150 deductible. We got them down to a point of 13% increase, and that's as low as they would go. That plan that we have with them basically guarantees us going forward that they will not laser out any catastrophic claims going forward. It means people that are in the plan today, that they cover today, will be in it in 2009 and 2010 if we insure through them in 2010. We looked at trying to get other quotes, trying to lower that fee. We looked at quotes from Sun Life. They gave us a number. We looked at 2 other reinsurance companies too. Those other insurance companies wanted the ability to laser out people going forward. If they had catastrophic claims, they would have the ability to maybe cut those people out of the plan next year and just let the city have complete liability for them. So we didn't like that option. Sun Life has the no laser option, and we went back to them trying to figure out a way to even cut the premium we paid to them a little, cut it down a little bit. And basically they gave us an option of what they call an aggregating specific deductible. And what I'm recommending to you is that we keep the $150,000 deductible on each individual life, but we also take an aggregate of another $50,000. We're taking on $50,000 more in risk, and it's basically going to save us that much in the premium that they originally proposed. And that's what I'm recommending to you tonight. Sun Life also has our life insurance on our employees, and that premium, that we've got them to drop that down a little bit. That's 11.87% decrease in that premium. It averaged out to $77,000 this year, and they're cutting it down to $68,000. And that's basically because we shopped it around and got some other premiums, and they were able to decided they'd cut theirs down even further. Projected claims for 2009, when you look back at trends for the last 2 claims years and try to project those out, we're projecting $2,746,000 is what we're projecting. So the net effect of the increase by Blue Cross Blue Shield, the change in the deductible that we're paying to Sun Life, or that we're picking up from Sun Life and their fee, the decrease in the life insurance premiums along with the claims, we're projecting total expenses for the health plan next year of $3,228,000. Now we fund through premiums by the city and by employees $3,370,000. So we believe we'll add to the fund balance next year. I have a slide and it's in your packet too, what we think our fund balance will look like next year. Currently, at June 30th of 2008, we had a $4,690,000 fund balance for the health insurance fund, and we're looking at, based on these estimates right now, that we'll increase that by $161,000 at the end of 2009. And I'll be happy to answer any questions you have about the health plan.
Do we have a motion and a second to approve this health plan?
So moved.
Second.
We have our motion and our second. Discussion by the council.
So you feel confident in the recommendation and after running the numbers?
I do.
Okay.
I have looked through several different options trying to figure out how we can possibly save some money with the plan, especially on the reinsurance, and I think this is the best option that they gave us.
Well, I want to commend Mike. On Monday, we were looking at this, had some other options. He was able to go out and get some other quotes, one of which we're using now, I'm assuming, because it was the option 4 here, this reinsurance for the additional $50,000. I think the interesting thing of the presentation you made, we only had 12 people with claims over 25,000. That's pretty good, considering that's less than 2% of our total workforce. It means our people are healthy and participating in wellness programs, which is always commendable, and we'd like to encourage the other ones that aren't participating to do so. But I'd just like to commend the council before us. Obviously none of us want a catastrophic event, but we've got a fund balance currently of $4.6 million to cover these kind of losses in case we do have them, and it's a level of comfort for our employees knowing that we're going to be there to help them and support them when it comes to their benefits. So it's to be commended for that.
Thank you. Any other comments by the council?
I'm glad we're not going to take a larger risk, but this is, I think, a good comfort zone. Save some money, but still not go all the way to having taken a large risk.
Mike, over the last 5 years, the premiums we paid for reinsurance totaled over $1 million.
They did.
And in that 5-year period, we went over the limit a couple of times, maybe got back $25,000.
We haven't gotten reimbursed that much. That's what, when you look at it that way, that's what really just, it's really upsetting to look at it that way, to see how much money you pay out, and it's insurance and you don't really need it or until you have a claim, and then you're happy you have it. But
well, in this case, we're making sure our people are working safe. We have a lot of employees out there that are doing dangerous things every day, working in the street and picking up garbage. Our safety people here, so and that money can go away pretty quick, so that's why we have this in place.
It's good, Mike. Appreciate you getting us the best deal we can. And insurance is never, it's never a pleasant
well, as Jim
thing to
said,
pay.
when I first looked at that, I was thinking we just need to get out of the reinsurance business, but the more I thought about it, I just don't think we can do that.
We were tempted, though.
No, we were tempted when you look at it on past performance, yes.
Very good. Any further comments? Any comments from the audience? All right. Seeing no further comments, I'll vote.
5 yes votes, motion carries.
Thank you.
Mr. Davidson. Item 6, consider appointments to the Planning Commission. Sponsor Mr. James Mills. And
Wait a minute, I guess I can handle
I'll
that.
defer that to you.
What numbers?
We're anxious for Mr. Mills to be
6.
joining us again soon.
Have 3 members of the Planning Commission that have terms that will expire on January the 1st, 2009. Each of those 3 members have indicated they'd like to continue to serve, and we would certainly like to have them continue to serve. That's Dr. Angelo Volpe, Jim Staffney, who serves as chairman and does a great job, and Randy Dalton. And on behalf of Mr. Mills, I would recommend your approval.
All right. I'd like to make that in the form of a motion if I could get a second to accept those folks. All right. Have our motion and our second. Any discussion by the council?
As council's rep for Planning Commission, just appreciate these people serving. Of course, Randy's a new appointee, but he's been there a couple months. But this is a very integral part, serving on the Planning Commission, of what we're doing in our community and managing its growth. And so we really appreciate these people volunteering their time and services to our community.
And Mayor, if I'm sure James is watching, I've got a message for him. Press. He'll know what that means.
Well, we really, having served on the Planning Commission in the prior term in the position that Councilman Williams serves in, it's a really demanding job. It's a lot of information and a lot of tough decisions made in there, and it isn't something that we take very lightly, and we certainly do appreciate those folks serving on that commission. Any further comments? Any comments from the audience? Seeing no comments, I'll vote.
5 yes votes, motion carries.
Thank you, Mr. Shipley. Item 7, consider appointments to the Sewer Regulations Appeals Board. Sponsor, Mr. Ronnie Kelly.
Mayor and Council, the Sewer Appeals Board is made up of 5 members, and they're served 3-year terms, and they can't serve over 2 terms without a 1-year break. The board's set up to conduct appeals to decisions that we may make if we have an industrial client that we permitted and we're trying to regulate them on their discharge and so forth, and they don't agree with our decision, then they can appeal to this board. The two members that we would recommend, Dan Ike, he's within Dixie Imperial Plating here in town, and Dr. Martha Wells, she's a professor of chemistry that we have done some work with in the past, and they've agreed to serve on the board. The 2 members that are going off are Larry Wheaton and Ernie Talbert, and we'd make that recommendation.
Do we have a motion and a second to
Move
approve?
approval.
Second.
Have our motion and our second. Any discussion by the council? I'd just say that Larry Wheaton and Ernie Talbert both, I'm sure, have been good members, and we hate to see them go, but it looks like you've made some good recommendations.
Yeah, one thing the board's never met, because nobody's ever appealed our decisions.
I was about to say,
That's
this
a
is
good
It is.
a prestigious board to be on.
They stepped down because it was too boring.
No, their terms expired.
Yeah. Well, it's good that it's in place. We're glad that they're willing to serve. Any further comments from the council? Comments from the audience? Seeing none, I'll vote.
I was
5
telling
yes
Mr.
votes, motion
Peak that I've never heard the term laser out. I'm not sure about that term, if that's a medical term or where that came from. Yeah, I know.
Insurance term.
I think it means
Thank you, Mr. Kelly.
Whatever it is, you don't want it to happen to you.
Yeah. Item 8, consider declaring as surplus vehicles and equipment. Sponsor, Mr. Mike Davidson.
I think I'm going to handle that.
Okay. Mr. Shipley.
The departments involved, excuse me, customer service, the animal shelter, police department, human resources, public works, and the fire department. The fire department's the 1970 Mack pumper that's being declared surplus. That'll be replaced by the new vehicle that we're going to get in any time, I guess.
I talked to him today, and we moved back to January 12th.
So we don't have to pay for it till then. Okay, that's good. The vehicles, there's a Illumina. I don't have the years on a lot of these. 137,000 miles. The Dodge Dynasty with 178,000. The animal shelter van, GMC van, says 10,328 miles. That's turned over at least once. Probably more. Police department to Crown Vic, over 100,000 miles. The Pontiac Bonneville and Human Resources. I think I remember when we bought that car from state surplus, and it had 60 or 70,000 miles on it at the time. So that's probably turned over once too. Public Works 2002 sweeper that we just replaced, and we'll be lucky to get somebody to take that thing, right? Yeah.
That's a fine sweeper.
Yeah.
it's a fun.
And an 85 Ford pickup with 104,000 miles on it. I would recommend
That
for
would get
approval.
work vouchering, can't you?
Yeah.
Easy now.
Move for approval.
Second. Have our motion and our second to approve these vehicles as...
Was the Leisure Services Department able to pick through these before they?
We had to ask.
Just
Greg.
wanted to make sure.
They get first option.
I thought they did.
Any further comments by the council? Any comments by the audience? Seeing none, I'll vote.
5 yes votes, motion carries.
Thank you, Mr. Shipley. Item 9, consider awarding the bid for trees. Sponsor, Ms. Kathy Andrews.
Mayor and City Council, the tree board, in conjunction with the City of Cookeville, advertised and opened bids to purchase and plant trees in various locations within the City of Cookeville. Those locations include Cinderella Park, Walnut Park, City Cemetery, and Dogwood Park. I recommend Funk's Landscaping, they're the low bidder.
All right, do we have a motion second to approve?
Move for approval.
We
Second.
have our motion and our second. Any discussion by the council? Any comments from the audience? See no comments, I'll vote.
5 yes votes, motion carries.
Thank you,
Thank
Ms.
you.
Andrews. And at this time, we open up the floor for 3 minutes to hearing of citizens and/or delegations, and you can come to the city council meetings first and third Thursdays of every month. Although, January, are we having our first meeting in January?
We're only having the, only meeting on the third Thursday in
Only
January.
meeting on the third Thursday in January. Through the, I guess, the holidays and the New Year's. So, you know, please come and speak your mind here at the city council meetings. We're glad to do that. I've just got one comment to make. Several of us attended today at the courthouse. Governor Phil Bredesen was in town and swore in our new judicial district attorney, Mr. Randy York, and had a good ceremony. I think we've got a good person in that position now to help keep our community safe and take care of us here. And I don't know if Mr. Rader has any comments about Mr. York, but there were a lot of good comments made about him today.
Oh, I think Mr. York is an outstanding person to fill this job. He's got a lot of experience. He's very well respected in the legal community and in the communities where he's worked. And I just think there could not have been a better candidate selection than Randy York for that office.
Seems like a good man. And open up the floor to the council. Any comments, announcements? I know we've got...
Of course, we're going to wish everyone to have a happy holiday season and to be safe and
Shop in Cookeville.
shop in Cookeville.
Yeah.
Watch that. Make sure your candles are put out at home and don't have any kind of fire hazards. Right, Chief?
That'll be good. Very good.
Looking forward to a good new year. It'll be tight, but we'll make it.
Yeah, 2009 may be a tough year for us, but I believe if we just hunker down, we'll be all right. Hopefully we'll get some good plans come January. So, seeing no further comments, I'll entertain a motion to adjourn.
So moved and seconded.